It starts as a secret you keep from your spouse, a secret you keep from your friends at the golf course or the book club. It's that nag of discomfort when you sit down for dinner. It's the terrifying moment you look into the toilet bowl and see bright red, and your heart stops. Is it cancer? Is something rupturing inside me? Or is it just impolite to talk about? If you are watching this, you are likely part of the silent majority. You see, in my 10 years of clinical practice, I have treated thousands of patients who waited years, sometimes decades, to walk through my door because of shame. They suffered through itching, pain, and bleeding because they thought they were alone. But here's the truth. You were born with hemorrhoids. Everyone has them. And for 1 in 20 of us, they turn into a medical problem that ruins our quality of life. Today, we are stripping away the embarrassment. I am going to explain exactly what is happening in your body, why your smartphone might be your worst enemy, and the definitive treatments that actually work, based on the freshly released 2024 Clinical Practice Guidelines. I'm Dr. Sarah Collins, and it's time to stop suffering in silence. Let's start with a revelation that usually shocks my patients. Hemorrhoids are not growths. They are not tumors. They are a normal part of your human anatomy. Think of the anal canal like a watertight seal. To keep that seal tight so you don't have accidents, your body uses specialized cushions of blood vessels and connective tissue. Those cushions are your hemorrhoids. You need them. The disease, what we call symptomatic hemorrhoids, happens when the support structures holding those cushions weaken. They start to slide down, swell up, and bleed. Now, location is everything. We divide these into 2 neighborhoods, separated by something called the dentate line. First, internal hemorrhoids. These live deep inside. The lining here has no pain nerves. This is why you can have massive internal hemorrhoids and feel zero pain. The hallmark sign here is painless bright red blood, usually covering the stool or dripping into the toilet, or a feeling like tissue is protruding when you wipe. Second, external hemorrhoids. These lie right at the opening, under the sensitive skin. This is the pain neighborhood. When these swell, they itch, they burn. And if a blood clot forms inside one, what we call a thrombosed hemorrhoid, it can feel like sitting on a marble made of broken glass. It turns blue or purple and is excruciating. Before we fix them, we have to talk about the red flag. The biggest mistake patients make is assuming all rectal bleeding is hemorrhoids. While hemorrhoids are the most common cause, rectal bleeding is also the primary warning sign for colorectal cancer and inflammatory bowel disease. Depending on your age and risk factors, catch-all hemorrhoid treatment is dangerous if we haven't looked inside. According to the 2024 guidelines, if you have new rectal bleeding, you need an evaluation, often a colonoscopy, to rule out the scary stuff first. Once we know you're safe, then we can treat the plumbing. Why do these cushions fail? It comes down to one word: pressure. Hemorrhoids are essentially varicose veins of the bottom. Anything that increases pressure in your abdomen pushes blood down into those pelvic veins, stretching them out until they can't snap back. Here are the culprits I see most in patients over 50. First, the chronic strain. Constipation is the enemy. Straining to have a bowel movement is like inflating a balloon that's already full. It forces those cushions out. Second, the aging process. As we age, the connective tissue that anchors these hemorrhoids to the muscle wall degrades. It gets loose. It's the same reason we get wrinkles. Gravity wins. Third, the modern curse. Phone on the throne. This is a massive issue. When you sit on a toilet, your rectum is lower than your hips. Gravity pulls blood there. If you sit there for 20 minutes playing Candy Crush or reading the news, you are subjecting those veins to massive trauma. My rule: 3 minutes. If it hasn't happened by then, get up and try again later. The toilet is not a library. The good news? The American Society of Colon and Rectal Surgeons notes that most patients can solve their symptoms without ever seeing the inside of an operating room. Here is the gold standard conservative protocol. Step 1. The fiber equation. You have heard, eat more fiber, but you are probably doing it wrong. we need you to hit 20 to 35 grams of fiber a day. This bulks up the stool and softens it, so it passes without straining. Real food like avocados, berries, beans, and bran is huge. But the secret weapon is psyllium husk. In studies, psyllium supplements reduced bleeding by 50%. Start slow to avoid bloating. Step 2. Hydration. Fiber acts like a sponge. If you eat fiber but don't drink water, you just make a rock-hard cement brick in your colon. You must drink 6 to 8 glasses of water a day to activate the fiber. Step 3. The sitz bath. It sounds old-fashioned, but soaking your bottom in warm water for 10-15 minutes relaxes the internal sphincter muscle. This increases blood flow and promotes healing. No soap, just warm water. Step 4. Toilet mechanics. Get a toilet stool. Elevating your knees straightens out the anorectal angle, allowing gravity to do the work so you don't have to push. Try this for 2 weeks. If there is no change, you need to see a doctor. What if the fiber doesn't work? What if the tissue is protruding? At this stage, creams won't fix the mechanical problem. We need intervention. For internal hemorrhoids that bleed or protrude, banding is the most effective office-based treatment. Here's what we do. Through a small scope, we place a tiny rubber band at the base of the hemorrhoid, way up inside where you have no pain nerves. It cuts off the blood flow. The tissue shrivels and falls off in a few days. It is simple, effective, and you usually only feel a dull ache for 24 hours. When surgery is necessary, usually for large external tags or severe internal cases, we have options. Excisional hemorrhoidectomy is the traditional surgery where we physically remove the tissue. It has the lowest recurrence rate, but I will be honest with you. It has a reputation for being painful during recovery. However, with modern pain management, it is manageable. There is also stapled hemorrhoidopexy, which uses a circular stapler to pull the tissue back up. It has less immediate pain than cutting, but higher recurrence rates long-term. A special note on acute thrombosis. If you wake up with a painful, blue, hard lump the size of a grape at the anal opening, that is a blood clot. The rule is simple. If you catch it in the first 72 hours, go to a specialist immediately. We can make a small incision and remove the clot under local anesthesia, providing instant relief. If it's been more than 3 days, the body is already reabsorbing it. Surgery might cause more pain than just waiting it out with ice and baths. Managing hemorrhoids is a marathon, not a sprint. It requires a lifestyle shift. But I want you to take one thing away from this video. Your quality of life matters. You do not have to plan your day around the location of the nearest restroom. You do not have to live with the fear of bleeding. We have solutions. From a simple packet of fiber supplement to a 5-minute office procedure, we can fix this. So, throw away the shame. Make that appointment. Get checked out. Because the only thing worse than having hemorrhoids is letting them ruin your life when the solution is right in front of you. If you found this guide helpful, please share it. You never know who among your friends is suffering in silence. I'm Dr. Sarah Collins, here to help you live healthier, longer. See you in the next video.